Great, thank you, Paul. So yeah, welcome everyone this morning, and thank you for coming to the variety stage. So my name is Michelle Saunders, and I'm Workplace Health Officer at Medway Council, and James is my colleague. And we actually work for Medway Council, but on behalf of KCC and Medway, we run the Kent and Medway Healthy Workplaces programme across the whole of Kent. The programme was successfully run in Medway for the last 2.5 years, and this month we're now opening it up to other Kent businesses. So we're going to sort of talk about that a little bit this morning, and how you can sort of construct better health within your workplace for your members of staff. So the first question really, just to have a think about, is why does workplace health matter? I think it's been rising on the corporate agenda more and more over the last couple of years, and particularly with the recent events around coronavirus and the lockdown, impact on mental and physical health has sort of never been more prevalent really. I'll just show some very brief sort of statistics. I don't talk too much on numbers and send you to sleep on a Thursday morning with PowerPoint, but these do sort of bring home the importance of it. So 1 in 3 people of working age report having at least one long-term health condition, and in the next 10 years this is set to rise to 40%. These statistics come from a study undertaken by the University of Lancaster. Lots of familiar sickness data, so 131 million working days lost due to sickness absence. And then on the slide there you can see how much of that was to minor illnesses, musculoskeletal problems. I mean, obviously for the construction industry that can be a particular issue where people are doing physical jobs. And then that 14.3 million days lost to anxiety and depression. So lots of loss to the economy and to businesses through people being unwell when they're in work. So stress, leading on from that anxiety and depression, stress is a huge cost to the UK economy at £3.7 billion a year. Alcohol, something else we look at within healthy workplaces, is a factor in up to 20% of workplace accidents. Obviously nobody wants to have an accident in the workplace, and if we can mitigate that and put things in place to protect people, obviously can bring that down further. 1 in 10 employees living with a musculoskeletal condition, so on top of the sort of part of the 1 in 3 people with a long-term health condition, 1 in 10 members of staff have a musculoskeletal condition, which probably contributes to that 28 million working days lost. But never think about the size of your own teams or the organisations that you perhaps work with, sort of looking across the work site or the office. That's actually a considerable amount of people that are suffering and in pain. And smokers, fortunately, smoking rates are coming down in Kent and Medway, but smokers are still 1.5 times more likely to take sick leave than their non-smoking colleagues. Again, a further cost to the business and to people's health, as we all know that it really isn't good for us, and it's one of the leading causes of cardiovascular disease. So workplace health obviously matters not just for the economic cost and the cost to ill health, but it's actually work can be good for us. So if someone is in good health, as this diagram shows at the top here, they're actually more productive. And a more productive worker will improve business competitiveness. And if your business is more competitive, more efficient, it's going to lead on to that economic development and prosperity, which in turn supports social wellbeing and health. So if people are more prosperous, they can access better health and social activities, perhaps join gyms and take up activities that they maybe wouldn't have been able to afford if they weren't working or weren't earning a good salary. And then that social wellbeing and health leads to further good worker health, and you get that positive cycle. So a healthy and happy workforce is good for the workplace, good for the economics of the workplace, good for the bottom line, and it's good for that corporate and social responsibility to know that you're looking after your staff. Good for productivity. We often hear about the productivity gap in the UK economy, and this is something that can be worked through, and improving workplace health can help to address some of that issue. And then obviously for the economy and society at large, if we're all happier and healthier in work, we're going to be happier and healthier outside of work, and the general benefits to society at large are really quite remarkable. Obviously then this is a construction expo this morning, so we've got some interesting figures here about particular issues in construction. Obviously construction is a huge sector in the UK economy and a large sector of the economy in Kent and Medway. So in 2019, the Chartered Institute of Building reported on some health statistics. They actually released these in May this year to coincide with Mental Health Awareness Week, although the statistics were taken before the pandemic, so do bear that in mind. Although even though they're taken before the pandemic, unfortunately there is a little bit of grim reading here, so we'll get the bad news out of the way first. So 26% of construction workers had really sadly experienced suicidal feelings, and research does show that construction workers are more at risk of suicide. The reasons are not fully understood, but include things like they're working away from home, perhaps lack of support networks, work pressures, and the means of access to do these things. So it's definitely something that we can address through a healthy workplace programme and initiatives to help people feel supported and reduce that risk and reduce those people having those feelings, or at least knowing how to manage those and get the help that they need. 97% of the people completing the Chartered Institute of Building survey reported feeling stressed at least once in the past 12 months. 56% of construction professionals were working in organisations that didn't have a mental health or a policy or a plan in place. So they perhaps, I mean, that's not to say they weren't being supported, but the support wasn't documented, and they perhaps didn't feel that their employer was taking care of them and working with them in a way that sort of underpinned their health at work. 70% of those responding had experienced depression. 36% of construction workers said that they didn't have adequate access to toilet and hand washing facilities, and I'm sure that's not the case for the businesses attending today, but it just does bring home even having those basic needs met has a massive impact on people's well-being and mental health in the workplace, and now so more than ever the importance of hand washing regularly to keep that virus at bay and keep ourselves healthy. And 87% of the respondents had also experienced anxiety. So that is some sort of grim reading, but the good news is there are things out there that we can do. But I'm briefly just going to touch a little bit more on suicide before we move on. So unfortunately, suicide accounts for 1% of all deaths in Kent and Medway, and that's slightly higher than the national average. So just to sort of make it a little bit more interactive, there's some gaps in these sentences. If you wouldn't mind popping in the chat box what you think the missing word should be. So suicide accounts for something, deaths, then road traffic accidents. So just give you a minute to pop what you might think that missing word is. Yeah, thank you for the answers coming through. I think you all know, unfortunately, it is more than road traffic accidents, which is a sort of very sort of alarming statistic. And often when we do our mental health training, people don't realise that is the case. So 2019 suicide rate was the something since 2000. People write in the chat box what they think that answer might be for me. Yeah, Kyle and Gina, you're totally right. It was unfortunately the highest. Yes, Andy, David, you've all got the right answer that unfortunately it was the highest since 2000. And mental health is one of the top causes of absence. This isn't just in construction, this is across the board. And it attributes to something of all absence. So it's looking for sort of a rough percentage, if anyone would like to hazard a guess as to what percentage of mental health causes absence. It's a good, yeah, Carl's put, is it always reported? Well, the reported stat is 12.5%. So, but obviously a lot of it does, you're right, a lot of it does go unreported. So it probably is closer to some of the statistics people are suggesting. We do have evidence to say that people might take mental health absence and give a different reason for being off, perhaps because they don't feel that they can be honest. As the reasons why they aren't in work that day. So obviously we're in the midst of a pandemic, so let's have a look at what COVID has done, or what we know that it might have done to our mental health and physical health so far. And undoubtedly it's had a huge impact on us, and the Office of National Statistics have undertaken a bit of research. So in ordinary times and before all this craziness happened, it was reported that 1 in 6 people have mental ill health in a year. But the Office of National Statistics found that actually 8 out of 10 people were experiencing early signs of mental health in the past 12 months, and most of that had occurred in the last 9 months, so most of it during the period of the pandemic. There's been an increase in abuse towards customer-facing workers, and this research came from Usdaw, but we've also sort of seen it anecdotally through healthcare workers and delivery drivers as well. So perhaps if some of your staff are out delivering, or you're having delivery drivers come to site, it's just something to bear in mind, that whilst you're going to be kind to them, obviously, that they may not be having a great day from other deliveries that they've done. A threefold rise in people self-reporting anxiety and depression, and poorer outcomes for people with existing health conditions. I think it was quite sort of well documented on the news when Boris was unwell with coronavirus, and he's then sort of got on the better health message that actually people who have got diabetes or obesity or various different health concerns are like to have poorer outcomes if they were to get COVID, and perhaps more likely to suffer from it if they're not in good health in the first place. So that's another reason to look after ourselves at work and look after our colleagues, so that we can limit the risk of catching COVID and other illnesses, and limit the outcomes of those that might affect us as we go down the line. Your Public Health England interestingly estimate that 2/3 of us aged in our 40s and 50s are going to reach retirement in poor health if we don't do something now. And I think that's just so sad, that we work so hard through our working lives, and that 2/3 of us are going to reach retirement in poor health. But actually it doesn't have to be that way, because by starting on a healthier journey now and staying well, we can actually enjoy our retirements and lead a long and happy retirement. In terms of COVID and construction, Loughborough University undertook a study at 6 different construction sites across the country, and actually it's quite interesting that it wasn't all bad news. Through their learning from COVID, they actually found that there were some positives to be gained from it in terms of sort of staff's well-being. So the fact that there was more space and fewer people on sites, there's less overlap of trades in the workplace, which improved productivity and made the workplace a bit safer. There was improved task planning and improved planning by workers, less double handling of materials, which obviously with the virus we want to handle stuff as little as possible. The more streamlined worker flow sort of reduced the need to queue for site access and changing rooms. It made things sort of a bit more efficient, a bit cleaner. On site there was a perception that those who'd come back to work were more motivated and team players, and people sort of pulled together more. So there were some positives to be learned from it. In some additional sort of findings, which I haven't put on the slide, I only read about this yesterday, that Bupa last week carried out a survey of chief executives and found that employees had felt more grateful during the last sort of quarter of the year. They felt more grateful for their health and relationships. And over half of bosses had increased their focus on health and well-being, and admitted that the pandemic had prompted them to reassess their goals and values in the business. So this is a perfect time to start to look at health at work if you haven't done that before. I'm now going to hand over to James, and he's going to talk a bit more about what we actually mean by well-being and the support that's available in Kent and Medway. So James, over to you.
Thank you, Michelle. Good afternoon. Well, good morning, everyone. Thank you for coming to the presentation today. I understand we're up against economic development, so the money and health kind of debate is a long one, and I think as Michelle's just kind of illustrated, that the two are actually really very much intertwined if we want to be getting the best from our staff. Getting the best from our staff is quite an interesting area, and to really understand how people are doing, we need to move away from any traditional health beliefs that we are either healthy or we are unwell. I think COVID and the pandemic has very much demonstrated that health and our well-being more broadly, particularly our mental well-being, fluctuates greatly and can change really over the course of a day, over the course of an hour, and will be obviously naturally hugely different from the beginning of a week to the end of the week. This cross-axis model here is quite widely adopted in the mental wellbeing world, and at the top it shows that people can be in a state of flourishing and kind of doing well and feeling good, and that actually at the bottom we can see people who are languishing. But the interesting part is that whether we display symptoms of mental illness, or we have many or severe symptoms, we do not need a diagnosis of depression to be in a languishing state of mental well-being. We do not need to have generalized anxiety disorder to be having a bad day. And it's quite common for people to experience symptoms of those quite severe diagnosed conditions, but actually be in a flourishing state of well-being. So it's quite possible to have a long-term mental health condition and be in a really positive state of well-being. So I think this model here just is really to kind of illustrate that we don't have any static kind of well-being. Just because I'm well at one point in the day, it doesn't mean that I'm going to be well later in the day. And all of the time we've got these external pressures bearing down upon us, that's going to change. So how do we do that? Kind of what do we take from that? Well, it means that if we're in a languishing state of well-being, something needs to be done about it. And we have a personal responsibility to do that for ourselves and acknowledge maybe that that's going on. But we also need to be conscious about what our teams, what our direct reports, what our colleagues, friends, family are kind of experiencing and what we're seeing presented from them. Because for those people who are in a languishing state here, it could be quite visible, and we might be able to help them. So Michelle, if you want to move to the next slide.
Bear with me.
No, so there are going to be a huge number of things that are going to be impacting particularly our mental well-being, and we've just focused on this one area at the moment. I think in light of COVID, it's probably had a bit of a spotlight shone on it more than it has certainly in my working lifetime. I think more people are aware of what aggravates and triggers them, what makes them feel worse at the moment, and there's a whole list of kind of different bits up there. We know that financial worry is one of the most significant things that impacts people's mental well-being, and kind of we need to bear that in mind, that at the moment we've kind of got a very, very fluid kind of market that's trying to bounce back and kind of return to a new normal. But what the long-term implications of COVID and the kind of economic fallout from this are going to be significantly affected in the construction industry, much like they were previously when we had the recession in 2008. We want to make sure that that isn't the case. That if it does happen, we need to put in place certain amounts of support for those individuals. One of the other key things I'd like to point out there is about retirement. Retirement is something that's often forgotten, and we do need to bear in mind that we've got a significantly aging workforce, which over the next few years is going to come to a bit of a head where we have a huge number of people exiting the kind of work. Retirement can be a very transitional period with a great deal of change, and that can have a huge impact on people, not just a loss of skills for those organisations, but a sense of belonging no longer perhaps being there for those individuals. And we do sadly see people's health quickly decline around retirement, not because their physical well-being they've not taken care of themselves, but actually that they are that their transitional changes had a negative impact. Don't forget, it can also lead to a huge amount of anxiety on that kind of time building up to that area there. So we try in our workplace program to offer support and guidance around that. Michelle, would you want to click in on? So what can we do to kind of practically advise and push people to a more flourishing state of well-being? This is the Six Waste Wellbeing, which is promoted by KCC and was developed by the King's Fund, and it's quite well adopted, and hopefully many of you will have seen it before. But through these 6 simple actions, we can enhance our general state of wellbeing. So we can continue to be active, and as a workplace, we can promote and encourage our staff to take healthy action by encouraging more physical activity. Construction can, depending on your kind of your role, be quite a physical job. But if we've got office staff, we need to be encouraging them to get up and move around. We need to be encouraging them maybe by using standing desks. Physical inactivity is one of the largest kind of contributors to cardiovascular disease, which is also going to be exacerbating things like COVID and things. So we need to bear that in mind. As kind of humans, we've evolved to keep learning, whether that's new skills, hobbies, trades. We need to keep learning. Every day is a school day, as it were. Certainly learned a lot already from Paul this morning around how to use Zoom, and we need to be open to those new things because it's something which stretches our mind, and if we get a sense of enhancement of our mood from that, so whether it's picking up a new language or just kind of learning a new hobby, it's something meaningful, and we can support people to do that for our workplace, maybe through our kind of training schemes and programs. Giving, often people think about charity, but we need to recognise we have a lot more to give and offer than our financial capital. Our attention, our time, our knowledge, our expertise are huge things which we can give freely to people, which enhances our well-being and the people who are receiving it. So that's often something that we link with people with retirement around mentoring. If your organisation is a particularly large one, do you have a mentoring scheme? Do you support new people joining your organisation, supporting new apprentices coming on board or an experienced worker? Little steps that can be put in place that can actually optimise the well-being of both those kind of individuals. As a society, we're not meant to be alone. And in the chats earlier on, someone mentioned about home working and working from home. This could be a particularly very, very isolating time for people, especially if they are working from home. So we need to consider how we support staff, not just with kind of desk risk assessments and things like that, making sure they've got the physical equipment to work from home, but we need to provide people with an opportunity to connect. Do we still have a contact with our screen on, speaking to a member of staff? Is that sufficient for them? Do they do we need to arrange for walk-in socially distanced meetings where we have our catch-ups and things? There's some excellent guidance published by our workplace programme to kind of encourage people to consider how they support staff who are working remotely. And there's other kind of bits coming through from the National, and I'll link to that in the resources there, but it's something we should all consider. How do we take notice? Well, it's hard to ignore that it's getting a little bit colder and a little bit darker at the moment, and I'm very conscious that the weather and climate, apart from being typically British, is also something that we are acutely aware of and affects our mood, particularly when we're struggling with different things. That's just one example of how it can negatively impact us, but we do tend to blinker ourselves to some of the negative things that are going on, and it's very, very easy when you turn on the news and we see a lot of poor stories that are kind of quite negative. We need to look for the good. If we can reprogram our mind to be thankful and to look for the positives, we will become more acutely aware of them and we'll get a benefit from that. And we only need to think about kind of the kindnesses that people are showing to us, that we're showing to other people. They can actually enhance our sense of well-being. As a kind of a council employee, I'm acutely aware about the environment and the climate emergency which faces us globally at the moment. It fits within my kind of remit, the agenda of air quality, and it's something that I think is only being raised in platform and agenda. And if I think it wasn't for the global pandemic, it'd be something we were talking about a lot more when we look at the wildfires, rising sea levels and things. We all have a responsibility to kind of care for the planet and think about what's to come for our next generations. We can't also underestimate the link that that has to our well-being. People who undertake environmentally kind of positive actions do tend to survey as having a higher sense of well-being, that they're more in tune with the environment that's around them. As organisations, we have higher corporate responsibility for doing some of those things. Actually, it can be a positive to draw our staff into taking some of those actions and finding out maybe how they intend to support that can be something that's very positive. Can we move on to the next one, please? Just conscious of time. So what can we do to help? There is a huge amount that we can do. One of the most impactful things is actually thinking about the structure of how we take care of our staff and whether we have an action plan to put in place to take care of staff throughout the year. We have our robust workplace kind of health and safety risk assessments and workplace plans for when we're going to do returns, but we know that it's hugely impactful to have an action plan. We need to understand our employees' needs. Michelle and I work with hundreds of organisations kind of over the years, and no one workplaces are the same. They have different needs, different work teams, different approaches and ethos, ethics of doing things. So we need to assess and ask our staff what are their priorities and how we can help address those. The huge thing we often get asked is, how do we create a culture? Unfortunately, workplace positive wellbeing cultures are not something which can be bought. They can't just be put in place overnight. They are a systematic kind of change over a period of time, which really does start from the bottom up and the top down. But there are certain ways that you can do that, and following some of these standards that are listed from the kind of HSE, workplace health programme, and from the kind of NICE guidance that's available, are certainly ways that you can guarantee that are going to make positive strides towards creating that culture. And that's going to be supported by things like training, making sure that people are equipped with the skills and knowledge to be able to have informative conversations and support their workers in a way that's going to be meaningful for them. On to the next one. These slides are going to be available, so you'll be able to pick through any of these other bits here, and the same when we come up with the resources links in a little while. So they've got a few other kind of programs on that bit there for some of these other parts. But if we move on to the program, Michelle.
Yes, I was just skip through the resources, and there's some further standards there which can help.
Yeah, so if we just step on that, just that one bit here, there's a huge dearth of information available on resources, particularly that's been launched during the kind of a pandemic from government and also from a number of charities and things. We've seen our funding increase to expand our programme from Medway to Kent as a result. So kind of one of the points that we were looking to kind of convey today is that we do have a new Workplace Wellbeing Award available for organisations in Kent. That award isn't just about receiving a gong. There's a huge amount of support and guidance which is available and accessible through that programme, which organisations will be able to access. And that very much our programme takes a lot of the best practice that's identified in those standards that you can see there. So our programme is structured whereby all organisations complete a bronze award, and it's just making sure that those solid foundations are in place for any organisation who wants to really address workplace health and their staff support needs. We know that some of the most impactful things are things like absence management, robust training for managers, making sure that there's a sign-off. That's something that organisations are able to kind of just tick off and go through. I'd expect all organisations in the construction industry to be able to kind of satisfy that almost straight away. The really unique opportunities lie in the next slide, which starts to introduce the 8 themes of our programme, which support organisations. So managing absence and turnover, musculoskeletal health and screening. We obviously know at the moment during the pandemic that a huge number of people haven't been accessing screening services to check for things like breast, testicular, bowel cancers. They've not been going to those doctors because they haven't wanted to block the system. Unfortunately, the unintended consequence of that will be we will see an increase in the number of people with these lifelong debilitating conditions. And so we need to make sure that people are, through their workplace, potentially being advised to go and access those screening services. Mental well-being and stress, I can't stress it enough, excuse the pun, it's a huge impactful kind of area that we need to address, and we can absolutely support our staff. We know that mental well-being can be impacted by the type of work that we do, and that doesn't stop at work. We take that home, much like our home life impacts our working life as well. Stopping smoking, we see a huge increase in the number of people wanting to quit smoking at the moment. Workplaces can be a fantastic avenue to address and support people to do that, whether we've got a smoke-free working site that we're at, whether we've got the separate smoking areas for vaping areas. We've got lots of advice and guidance that we can promote and give to organisations to make sure that those are absolutely the most optimum they can be. Alcohol and substance misuse, Michelle mentioned, kind of attributable for around 25% of all workplace accidents. Where we've got random testing policy, there's a huge range of guidance that we're able to kind of promote and advise around this area. Healthy eating and healthy weight, it's a fantastic kind of area to address, and it's probably one that, due to stigma, people try not to, but you can absolutely shape and make subtle changes for people based on whether you've got a canteen, what your offer is, whether you provide facilities for people to prepare and store lunches and so on and so forth. And we offer advice and guidance around that. Physical activity and active travel, we've kind of touched upon, in the environment and sustainability. So each of those areas has a set of pledges. Some of those things organisations will already be doing, but wherever possible, we want people to try to do new things that are going to be more impactful for their workforces. We assess those, support and provide the resources to assist with that. One example would be through the provision of mental wellbeing training through our programme. We've got a number of sessions booked that are completely free for organisations to book onto, that will upskill managers and workforce and employees to be able to support their colleagues around low-lying mental wellbeing conversations. And on to the next one, Michelle, please. Once a number of pledges have been accredited, we give that award to an organisation so that they can show that they meet that standard. I'm going to mention the mental wellbeing training. If I go on to the next bit. So the other wider kind of benefits, this is what we're trying to address really. We want to improve sickness absence record and productivity. One of the big things that our programme has been able to really evidence is an increased level of staff engagement. Something, if anyone here is from HR will know, is absolutely critical to kind of one of our metrics for how we can see that our workforce is doing. And alongside that is the increased willingness to make a healthy, positive change. And that is very much indicative of that change in culture within an organisation. And that's something that we're able to support through the workplace programme. We've got a list there of other kind of benefits, the provision of NHS health checks to workforces at the workplace, so staff don't need to go and visit their GPs and things like that, alongside physical activity challenges. There's a whole host of things that you're going to be able to access if you join the programme. The training slides will be available after this. We'll also make our programme guide available as well. So if you are interested, you'll be able to see a little bit more of the very bespoke offer that will be available for your organisation. Over to the next one, Michelle. I think we've got a few case studies. It's just worth mentioning, we have been operating in Medway for, as Michelle mentioned earlier on, over 2.5 years. Lustre are a small organisation that joined us in 2015, originally kind of a workforce of 6. They're a consulting agency which focuses on ground surveillance before construction takes place. They have a very, very highly skilled, highly trained workforce with not a huge number of individuals capable of doing those roles. They found it quite competitive in the interview process, that there was a very small market for people to do those roles. Through this programme and the award, they were able to demonstrate to their prospective employees that they were an organisation that genuinely cared for their employees. And that had a huge, huge impact on the type of applications they were getting in. They found that people wanted to work for them because they knew that they were going to be taken care of. And that's a big trade-off that I think a lot of people are looking at the moment when you're looking at new roles. Are you going to an organisation that is going to make sure that you're well and fulfilled and taken care of over the years, kind of against the trade-off of a traditional kind of high income salary? I think we're starting to see a shift in particularly working conditions where people want more kind of focused support. We just move on to some of the next ones. So National Grid, an absolutely titan in the area, massive workforce in our kind of Medway location. Triggered by some unfortunate events, they've done a huge amount to tackle the workforce wellbeing needs in their across their employees, but they've also taken it to another level, and they're our first platinum organisation that supported the local community and got the kickback as an organisation as a result of that through volunteering in some of their other charity sectors. The representative from National Grid will actually be talking at our Kent launch event later in October. Stuart's been a huge advocate of the programme, and they've seen some massive gains from taking a more focused, holistic kind of approach to tackling wellbeing. Michelle, I'm just conscious of time, so if we just go on to the next one, and then I think we'll take some questions if anybody's got any.
Did you want to see that other case study? Or sorry, it's gone back too far.
That's quite rude. So I just put on that point there about who is responsible. So who is responsible in your organisation for the well-being of your staff? Is it kind of something that sits exclusively with HR, health and safety, or do we take responsibility for our staff at a management level, or do we all have a responsibility for making sure that the people that are around us are taken care of? Every organisation is going to have a different kind of approach to this. I think in a lot of examples that we work for, a blended approach is needed. We need to make sure that we have the policies, the principles and the offers in place to support everyone, but make sure that we've got skills and knowledge across the workforce for people to be able to support our colleagues, because we might be able to alleviate some of the kind of the problems with low mental well-being just with a very simple intervention and conversation early on before it gets to a more advanced stage. So this is the type of guidance and the types of conversations we're able to have with organisations on a one-to-one basis based on the evidence and the surveys that they complete. And it's a totally free offer. So Michelle later on is going to promote the sign up to the programme, and if anyone has any additional questions, we'll welcome them now, or we can deal with them over email as well. So any questions in the chat?